How late in the third trimester could a physician perform an abortion if he indicated it would impair the mental health of the woman?
Or physical health.
Okay.
Okay.
I'm talking about the mental health.
So, I mean, through the third trimester. The third trimester goes all the way up to 40 weeks.
Okay, but to the end of the third trimester.
Yep, I don't think we have a limit in the bill.
So, where it's obvious that a woman is about to give birth, she has physical signs of that she is about to give a birth, would that still be a point at which she could request an abortion if she was so certified? She's dilating.
Mr. Chairman, that would be a decision that the doctor, the physician, and the woman would make.
I understand that. I'm asking
point.
if your bill allows that.
My bill would allow that, yes.
No exception. There was a very contentious committee hearing yesterday when Fairfax County Delegate Kathy Tran made her case for lifting restrictions on third trimester abortions as well as other restrictions now in place. And she was pressed by a Republican delegate about whether her bill would permit an abortion even as a woman is essentially dilating, ready to give birth. And she answered that it would permit an abortion at that stage of labor. Do you support her measure and explain her answer?
Yeah, and I wasn't there, Julie, and I certainly can't speak for Delegate Tran, but I would tell you, first thing I would say, this is why decisions such as this should be made by providers, physicians, and the mothers and fathers that are involved. There are, when we talk about third trimester abortions, these are done with the consent of obviously the mother, with the consent of the physicians, more than one physician, by the way. And it's done in cases where there may be severe deformities, there may be a fetus that's non-viable. So in this particular example, if a mother is in labor, I can tell you exactly what would happen. The infant would be delivered. The infant would be kept comfortable. The infant would be resuscitated if that's what the mother and the family desired. And then a discussion would ensue between the physicians and the mother. So I think this was really blown out of proportion. But again, we want the government not to be involved in these types of decisions. We want the decision to be made by the mothers and their providers. And this is why, Julie, that legislators, most of whom are men, by the way, shouldn't be telling a woman what she should and shouldn't be doing with her body.
There could be no greater contrast to the beautiful image of a mother holding her infant child than the chilling displays our nation saw in recent days. Lawmakers in New York cheered with delight upon the passage of legislation that would allow a baby to be ripped from the mother's womb moments from birth. These are living, feeling, beautiful babies who will never get the chance to share their love and their dreams with the world. And then we had the case of the governor of Virginia, where he stated he would execute a baby after birth. To defend the dignity of every person, I am asking Congress to pass legislation to prohibit the late-term abortion of children who can feel pain in the mother's womb. Let us work together to build a culture that cherishes innocent life. and let us reaffirm a fundamental truth. All children, born and unborn, are made in the holy image of God.
This investigation of Planned Parenthood is based on false premises, one after another after another. It's time to stop wasting time, get on with meaningful work, and stop picking on women and trying to take their choice away. I yield back the balance of my time.
The time of the gentleman has expired. We welcome our distinguished witnesses today. Do you and each of you swear that the testimony that you are about to give shall be the truth, the whole truth, and nothing but the truth, so help you God? And I'll now begin by introducing today's witnesses. The first witness is Dr. Anthony Levatino. Dr. Levatino is a board-certified obstetrician gynecologist. Over the course of his career, Dr. Levatino has practiced obstetrics and gynecology in both private and university settings, including as an associate professor of OB/GYN at the Albany Medical College. And Dr. Levatino, we'll begin with you. Welcome.
Thank you, Chairman and members of the committee. I only have 5 minutes, so I'm going to get right to it. Second trimester D&E abortions performed between roughly 14 and 24 weeks of gestation. Your patient today is 17 years old. She's 22 weeks pregnant. Her baby is the length of your hand plus a couple of inches. And she's been feeling her baby kick for the last several weeks, but she's asleep on an operating room table. You walk into that operating room scrubbed and gowned, and after removing laminaria, you introduce a suction catheter into the uterus. This is a 14 French suction catheter. If she were 12 weeks pregnant or less, basically the width of your hand or smaller, you could basically do the entire procedure with this. But babies this big don't fit through catheters this size. After suctioning the amniotic fluid out from around the baby, you introduce an instrument called a Sofer clamp. It's about 13 inches long. It's made of stainless steel. The business end of this clamp is about 2.5 inches long and a half-inch wide. There are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. A D&E procedure is a blind abortion, so picture yourself introducing this and grabbing anything you can blindly and pull, and I do mean hard, and out pops a leg about that big, which you put down on the table next to you. Reach in again, pull out an arm about the same length, which you put down on the table next to you, and use this instrument again and again to tear out the spine, the intestines, the heart and lungs. Head on the baby that size is about the size of a large plum. Can't see it, but you pretty good idea you've got it if you've got your instrument around something and your fingers are spread about as far as they go. You know you did it right if you crush down on the instrument and white material runs out of the cervix. That was the baby's brains. Then you could pull out skull pieces. And you have a day like I had a lot of times, sometimes the little face comes back and stares back at you. Congratulations, you just successfully performed a second trimester D&E abortion. You just affirmed her right to choose.